body whispers before it shouts, and this conversation is about listening to our body. Hey all, I'm Dr. Pooja from Team Ayur Varta and SRV Ayurvedic Medical College and Hospital, Lucknow. And in conversation, we have with us our wonderful doctor, Dr. Sandeep Mishra sir. So we welcome you once again.
Thank you.
And the topic today is hernia. So let's get straight. My first question to you, sir. What is hernia and why does it develop?
Hernia is basically a protrusion of contents through the weakness in the wall of the body. So if anywhere there is weakness in the wall of the body, then when the contents inside comes out through that defect, it is known as hernia.
Okay, sir. Why does it happen? What are the common causes?
It happens when because sometimes it is congenital weakness and sometimes it is the weakness in the body, and due to the increased pressure inside, that defect gives way to the contents outside. So we develop hernia.
Okay, sir. So basically it's the weakness of abdominal wall.
Yes, ma'am.
Okay, sir. So what are the different types of hernia that we usually see and which of these are most common?
Ma'am, there are many types of hernia. Among them, inguinal hernia in males and incisional hernia in females are more common.
Okay, sir. Any chances we see them in children, because I've heard and I've seen cases of umbilical hernia. Apart from that, any other hernia?
Yes, ma'am. Congenital inguinal hernia is very common because, as we know, the testis is formed inside the abdomen, and in the 9th month it descends into the scrotum. So, through the path with which it descends to the scrotum, if that remains patent after the childbirth,
okay, sir,
then it causes inguinal hernia. Because to that path later on, if it is not obliterated, then the intestinal contents come to the tract and they form hernia.
Okay, sir. So mostly in males will find this condition in childhood.
Yes, ma'am. More
Okay,
common
sir.
in males.
Okay, sir. So are all hernias they painful or they remain silent?
Most of the hernias are not painful in general, but there is pain when there is obstruction. If the content of the hernia gets obstructed, strangulated, incarcerated, then there is development of the pain and fever and infection and all cascaded develops.
Okay, sir. So it's only after infection that
Yes,
pain will occur.
yes.
Okay, sir. So what are the early signs that people usually ignore?
Ma'am, if there is bulging in the body, anywhere in the bulging, which has impulse on cough. When you cough, when you strain, if that bulging increases, then you should be aware and get it diagnosed whether it is hernia or not.
Okay, so in any case, if there's a bulge, we have to consult a doctor, right?
Yes, ma'am.
Okay, sir. So there's a saying that lifting heavy weight causes hernia. How true is that?
It is true, ma'am, because whenever you strain, whenever you lift heavy weight, then the intra-abdominal pressure increases, and this may reveal any weakness in the abdominal wall, and it may develop hernia because that gives way and it forms hernia.
So lifting weight can be a reason for hernia.
Lifting weight in a person who is having abdominal wall weakness
Okay,
may
sir.
cause hernia.
So there has to be a condition, right?
Yes, ma'am. Not in
Okay,
all,
sir.
not in everybody who is lifting weight can get hernia, but anybody who have abdominal weakness, if he lifts weight, then he can get the hernia.
Okay, sir. So what are the dangerous signs, or is hernia ever life-threatening?
Yes, ma'am. Hernia may be life-threatening. If the content of the hernia gets strangulated, then the blood supply of that content reduced,
Okay, sir.
and that may get incarcerated and gangrene may form, and then may be life-threatening. Because in that condition, if you delay, then that part is necrosed, and we have to cut that part and again anastomose the intestine. And if patient delays, then it may be life-threatening.
Okay, sir. So basically, if patient tries to avoid or ignore
Yes.
hernia, it may lead to complications which can be life-threatening.
Yes, ma'am. Yes, ma'am.
Okay, sir. So can hernia get healed on its own, or is surgery the only option?
Hernia never heals on its own because it is a mechanical defect. It is a mechanical defect in the abdominal wall, so we have to either repair it or we have to do the hernioplasty. So it needs surgical treatment, then only it is cured.
Okay, sir. So even if the patient comes to us in early stages, then also you will recommend surgery itself.
Yes, ma'am. Because uh, it is the time when we can go for elective surgery. We can plan the surgery. But if the person delays it and linger on, and if he comes with the complications of the hernia, then it is very late, and we have to do emergency surgery. And many times in the emergency surgery, the recovery is not so good as in the elective surgery. So if the person comes to us with a hernia, we plan for elective surgery and go for surgery.
Okay, sir. So what are the surgical options available? Are they all very invasive or non-invasive techniques are also there? Or minimum invasion?
Yes, ma'am. Ma'am, there are many techniques of doing hernia surgery, and there are many reforms have came in the techniques of doing hernia surgery.
Okay, sir.
Nowadays, in open surgery, we go for Lichtenstein hernia repair, in which we do hernioplasty. We put a protein mesh or some synthetic mesh. After repairing the wall, we put the mesh and we strengthen the wall. And this is about the open technique. And apart from that, we have advanced technique laparoscopic hernia repair, in which through the two or three tiny holes, we go inside and we put the mesh from the inside abdominal wall. It is more mechanically strong.
Okay, sir.
As it covers the defect from the inside. We close the defect and put the mesh from the inside. In that also we have many choices like TAP, TAPT, TEP, ETEP. So many advanced techniques are there, and we can also go for robotic hernia repair surgery.
Okay, sir.
In which, with the help of robot, we dissect the different layers of the abdominal wall and put the mesh in the preperitoneal space.
Okay, sir. So there are many options available.
Yes, ma'am.
Okay, sir. So after doing hernioplasty, by any chance does hernia get recur?
Ma'am, there are chances, because as if the patient have got infection or if there is any other abnormality, sometimes the patients have collagen deficiency and the healing is not good, then hernia may reoccur. Or if the person is very obese, he have chronic cough, he is a chronic smoker, then there may be chances of recurrence of hernia.
Okay, sir. So how can hernia be prevented or recurrence reduced?
Ma'am, we can prevent the incisional hernia and some other hernias by preventing the infection, by preventing the straining. As you have heard of, that if after doing any surgery, we say that till 6 months you should avoid lifting weight, you should avoid straining, you should avoid cuffing, so that the abdominal wall which has or any wall which has been incised get healed properly.
Okay, sir.
It got such full strength in 6 months. So if before that, by anyhow, if anybody starts lifting weight or doing straining, cuffing, then there are chances of recurrence, and he can prevent it by preventing these things.
Okay, sir. So any dietary modifications needed?
Yes, ma'am. Because hernia is more commonly seen in malnutrited and poorly nutrited patients. So one should keep his nutrition good, take balanced diet after surgery, and take good amount of protein and prevent infection. So if all these are followed, then there are less chances of recurrence.
Okay, sir. So one takeaway message for our students and for our audience.
Ma'am, my take home message is that one should get it diagnosed early, get it treated early. There are lots of minimal invasive techniques like laparoscopic hernia repair, robotic hernia repair, in which the patient can get early recovery and can go back home early. So he should get it diagnosed and treated early, rather than waiting for the complication to occur and land up in complications.
Okay, sir. So thank you, sir, for all the information that you have provided on hernia. It is going to be very useful for our audience. And at last I would say, hernia, though not an emergency, can turn into an emergency. So it's better to take care of yourself. Even a small bulge, please do consult your doctor. बाकी की वार्ता in the next episode. Till then, स्वस्थ रहें, मस्त रहें, व्यस्त रहें.
Thank you.
धन्यवाद.
धन्यवाद.